Think of it like learning to play an instrument or master a sport. Daily practice creates incremental improvements that eventually compound into remarkable results. The men who achieve the most impressive outcomes are those who approach this as a long-term commitment to their health and well-being. And speaking of health, there are additional benefits beyond erectile function. The improved blood flow to the pelvic region can help with prostate health, urinary function, and even core stability. Many men report reduced nighttime urination after several months of practice. Harold, a 69-year-old with a history of prostate issues, began the technique primarily for erectile function. 3 months in, he noticed he was making fewer nighttime trips to the bathroom. His PSA levels also improved at his next checkup. While this isn't a treatment for prostate conditions, the improved circulation often has positive effects on overall pelvic health. There's something else I've observed in my patients who adopt this practice: a renewed sense of agency. For years, they've felt at the mercy of their aging bodies, dependent on doctors and medications. The progressive tension principle puts control back in their hands. It's empowering to improve your own health through your own efforts. This psychological component shouldn't be underestimated. Confidence and performance are intimately connected. When you know your body will respond reliably, performance anxiety diminishes. When performance anxiety diminishes, natural function improves even further. It's a positive cycle that builds upon itself. Let's talk about what to expect week by week. The first week, you may notice nothing at all. Don't be discouraged. Cellular. Changes are happening even if you can't perceive them yet. By week 2, many men report increased sensitivity and occasional improvements in morning erections. Weeks 3 and 4 often bring noticeable changes in firmness and duration. By week 6, partners typically begin to notice differences. 3 months in is when the full benefits usually become apparent. Some men ask if they should combine this technique with supplements or medications. While the progressive tension principle works well on its own, it can also complement other approaches. If you're currently taking prescribed medication for erectile dysfunction, don't stop without consulting your doctor. You may find you need lower doses as your natural function improves, but this should be medically supervised. As for supplements, be cautious. Many marketed for male enhancement contain undisclosed ingredients that can interact with medications or cause side effects. If you're considering supplements, choose those with research-backed ingredients like L-arginine, L-citrulline, or Panax ginseng, and always inform your doctor. Let me share one more story. Robert, 74, came to me after his wife passed away. After 47 years of marriage, he'd met someone new but was terrified of intimacy. "I haven't even tried in years," he admitted. "I don't know if anything works anymore." Robert committed to the progressive tension principle with the dedication of a much younger man. 6 months later, he sent me a wedding invitation. Sometimes, the results go far beyond the physical. Now, there are some important cautions. First, if you experience pain, stop immediately. This should never hurt. Second, avoid excessive pressure or aggressive techniques you might find online. More is not better. The progressive tension principle works precisely because it's gentle and progressive. Third, maintain reasonable expectations. This technique can create significant improvements, but it works within your body's natural potential. Some men ask how this differs from other techniques they may have heard about. The key difference is the focus on tissue health rather than temporary blood flow. Many popular enhancement methods create temporary engorgement, but do nothing to strengthen the tunica albuginea, the real determinant of lasting firmness. The progressive tension principle specifically targets tissue elasticity and regeneration. It's like the difference between temporarily inflating a weak balloon versus actually strengthening the balloon material itself. One gives a brief result, the other creates lasting change. I've dedicated my career to helping men maintain dignity and function as they age. I've seen countless innovations come and go, performed thousands of procedures, prescribed mountains of medications. Nothing has impressed me more than seeing men reclaim their natural function through this simple daily practice. The body has remarkable capacity for regeneration when given the right signals. The progressive tension principle provides those signals consistently and safely. It's not a miracle, but it is a methodology based on sound physiological principles. Principles that have been overlooked by a medical establishment more focused on pharmaceutical solutions. You might be wondering why more doctors aren't sharing this information. The unfortunate reality is that our medical system is structured around interventions and medications. A technique that men can perform independently, without ongoing medical supervision or prescriptions, doesn't generate revenue. It doesn't support the billion-dollar industry that is built up around erectile dysfunction. But I didn't become a doctor to sell pills. I became a doctor to help people. And after seeing the transformative effects of this technique in my own practice, I can't in good conscience keep it to myself any longer. Let me address another common concern. What if it doesn't work for me? First, understand that results vary. Some men see dramatic improvements, others more modest ones. The key factors are consistency, proper technique, and patience. If you're not seeing results after 3 months of daily practice, consider consulting with a urologist who specializes in men's sexual health. There may be underlying issues that need addressing alongside the progressive tension principle. But for the vast majority of men, especially those experiencing age-related changes, this technique offers significant benefits when performed correctly and consistently. I also want to address the emotional component of sexual decline. Many men feel shame, embarrassment, or a profound sense of loss. They stop initiating intimacy to avoid disappointment. They withdraw from their partners emotionally as well as physically. The relationship suffers, often in ways that extend far beyond the bedroom. Restoring sexual function isn't just about physical pleasure. It's about reconnecting with your partner, about feeling whole again, about reclaiming an essential aspect of your identity as a man. The confidence that comes from knowing your body will respond reliably transforms how you move through the world, not just how you perform in bed. Frank, a 68-year-old client, put it perfectly. I didn't realize how much my sexual decline was affecting everything else. My confidence at work, my willingness to socialize, even how I carried myself walking down the street. Getting my function back changed everything. I feel like myself again, not some diminished version of who I used to be. Let's talk about timing and patience. We live in a culture of immediate results, but your body doesn't work that way. The progressive tension principle creates lasting change precisely because it works gradually, allowing tissues to adapt and strengthen naturally. Don't be discouraged if you don't see dramatic changes in the first few weeks. The most significant improvements typically occur between months 3 and 6. Think of it like building a house. The foundation isn't the exciting part, but without it, nothing else stands. The first months of practice are building your foundation, strengthening tissues, improving blood flow, creating the conditions for lasting change. Trust the process. Hundreds of men before you have walked this path successfully. Another question I often hear: can I do more to speed up results? Patience is crucial, but there are complementary approaches that can support the progressive tension principle. Cardiovascular exercise improves overall circulation. Reducing alcohol consumption and quitting smoking significantly enhance blood vessel health. A diet rich in antioxidants supports tissue regeneration. Adequate sleep is essential for hormonal balance and cellular repair. These lifestyle factors won't replace the progressive tension principle, but they create an optimal environment for it to work. Think of them as fertilizer for a garden. The seeds still need planting and watering, the stretching technique. But the right conditions help them flourish. Let me be clear about realistic expectations. Will this make you significantly larger than your natural potential? No. This isn't about transformation into something you're not. It's about restoration, reclaiming what age and time have diminished. Most men experience a return to their peak size and firmness, sometimes with modest additional gains. The focus is on function, confidence, and satisfaction, yours and your partner's. George, 71, described it perfectly. I'm not winning any contests, but I'm back to my old self. My wife is happy, I'm happy. That's what matters. Let's discuss how this technique affects other aspects of sexual health. Many men report improvements in sensitivity and overall pleasure. The increased blood flow doesn't just improve firmness, it enhances sensation. Nerve endings receive better nourishment, leading to more intense and satisfying experiences. Some men also notice improvements in ejaculatory control. As confidence increases and performance anxiety decreases, the ability to maintain control often improves naturally. This isn't guaranteed, but it's a common secondary benefit that many men welcome. Imagine waking up one morning, looking down, and feeling that familiar disappointment. The same frustration you've been hiding for years. You reach for your pills, expensive ones, wondering if they'll even work today. Your partner sleeps beside you, but that invisible wall between you feels thicker than ever. Remember when intimacy was spontaneous? When you didn't have to plan, prepare, and still end up with mediocre results? What if I told you thousands of men just like you have discovered something so simple, so effective, that the pharmaceutical companies are scrambling to suppress it? A natural technique that's helping men in their 60s and 70s experience the kind of firmness and confidence they haven't felt since their 30s. I've spent over 3 decades as a urologist, and what I'm about to share with you changed everything. I thought I knew about male enhancement. This isn't some magic pill. It's not an embarrassing pump. And it certainly isn't dangerous surgery. It's a simple daily stretch that takes less than 4 minutes, requires no equipment, and can be done privately, in your bathroom or bedroom. Today, I'm breaking my silence, because you deserve to know what really works, what can truly restore not just your function, but your dignity as a man. The traditional medical establishment doesn't want you to hear this. They'd rather keep you dependent on their prescriptions and procedures. But I've seen too many men transform their lives with this technique to stay quiet any longer. Let me tell you about Richard. At 67, he had resigned himself to a sexless marriage. "Doc," he told me, "I've tried everything. The pills make my heart race. The injections are a nightmare. I'm too old for this fight." 3 months after learning this stretch, his wife called my office. She wanted to thank me personally. "I have my husband back," she said, her voice cracking with emotion. "We have our life back. But before I reveal this technique, you need to understand what's really happening inside your body. Because the problem isn't what you think. And the solution is simpler than you've been led to believe." When erectile function declines, most doctors focus entirely on blood flow. Yes, blood flow matters, but there's a critical component being completely overlooked, something that determines whether that blood stays where it needs to, creating and maintaining firmness. I'm talking about the tunica albuginea, the specialized tissue that forms the outer covering of the erectile chambers. Think of it like a balloon. If the rubber is thin, worn out, or has lost its elasticity, it doesn't matter how much air you pump in, it won't expand properly. Your erectile tissue works similarly. When the tunica albuginea loses elasticity, which happens naturally with age, your ability to achieve and maintain firmness decreases significantly. Here's what they don't tell you. This tissue can be strengthened and rejuvenated through specific stretching techniques. Just like you can strengthen a muscle, you can improve the elasticity and resilience of the tunica albuginea. And when you do, the results can be remarkable. This isn't theory. A 2018 study from the Journal of Sexual Medicine found that men who performed specialized stretching exercises, experienced measurable improvements in both length and firmness. Yet somehow, this research hasn't made it into standard treatment protocols. Why? Follow the money. There's little profit in teaching men a free technique they can do at home. The technique I'm about to share works on two critical levels. First, it gently stretches and strengthens the tunica albuginea, improving its elasticity and capacity. Second, it stimulates blood flow to the area, promoting cellular regeneration and tissue health. The combination creates a powerful, natural enhancement effect. But before I demonstrate, let me be clear about something. This isn't about becoming unnaturally large. It's about restoring your natural potential, the firmness, responsiveness, and confidence you once had. It's about waking up with morning erections again, about spontaneous intimacy, about looking your partner in the eyes with absolute confidence. The technique is called the progressive tension principle. It's based on the body's natural ability to adapt to gentle, consistent stress by becoming stronger. The same principle that builds muscle in the gym can restore erectile tissue when applied correctly. Here's how it works. In a warm shower or bath, warmth is important for blood flow and tissue flexibility. You'll perform a series of gentle stretches that progressively increase tension on the tunica albuginea. This isn't aggressive pulling or tugging. It's methodical, controlled stretching that sends a signal to your body to regenerate and strengthen the tissue. The warm-up phase is crucial. Never skip it. 5 minutes in warm water ensures blood flow is optimal and tissues are prepared. Cold water or cold environments will cause contraction and make the exercise less effective. Now, in a semi-erect state, not fully erect, but not completely flaccid, you'll grip just behind the glands with your thumb and forefinger using your dominant hand. With very gentle pressure, stretch straight outward for 30 seconds. No pain, no discomfort, just a mild sensation of stretch. Next, maintain the same grip, but stretch downward for 30 seconds, then upward for 30 seconds, then to the left and right, 30 seconds each. This completes one set. Rest for 1 minute, then repeat for a total of 3 sets. The entire process takes less than 4 minutes. That's it. 4 minutes daily to reclaim what many men believe is lost forever. But here's what's critical: consistency. This isn't a quick fix. Your body responds to patterns, to daily signals that tell it how to adapt. Missing days or performing the technique sporadically will significantly reduce results. The men who see the most dramatic improvements are those who make this a daily ritual, like brushing their teeth. After 2 weeks, many men notice the first changes, not necessarily in size yet, but in sensation and responsiveness. By the 1-month mark, improvements in firmness typically become apparent. By 3 months, both partners often notice measurable differences in size and performance. Let me emphasize again, this is gentle, progressive tension. If you feel pain or discomfort, you're doing it wrong. This isn't about forcing change. It's about encouraging your body's natural adaptive processes. James, a 72-year-old retired teacher, came to me after 2 failed surgeries. "I feel like less of a man," he confessed. "My wife says it doesn't matter, but I see it in her eyes." After learning this technique, James followed it religiously for 6 months. At his follow-up appointment, he couldn't stop smiling. "I didn't just get my function back," he told me. "I got my confidence back. My whole life feels different." What James experienced wasn't just physical. The psychological impact of restored function can transform every aspect of a man's life. Research shows that men who regain sexual confidence report improvements in work performance, social relationships, and overall happiness. The effects ripple outward, touching every part of your existence. Now, let's address some common questions. Does age matter? While younger tissue responds faster, I've seen remarkable results in men well into their 70s. The body's capacity for regeneration continues throughout life. It may take longer as you age, but the potential for improvement remains. What about men with diabetes or heart conditions? Always consult your doctor before beginning any new regimen. However, this technique is generally safe for men with these conditions. In fact, the improved blood flow can have additional health benefits beyond erectile function. Will this help with premature ejaculation? Indirectly, yes. Many men report improved control as their confidence increases. The psychological component of performance anxiety often diminishes as physical function improves. Is there anyone who shouldn't try this? Men with Peyronie's disease, a condition involving scar tissue and curvature, should consult a specialist before attempting any stretching technique. Similarly, anyone with a history of priapism should seek medical guidance first. But for the vast majority of men experiencing age-related changes in erectile function, this technique offers a safe, natural approach to restoration. Let me tell you about Michael, a 65-year-old executive who had spent thousands on treatments. The pills worked at first, he said, but the side effects got worse. Headaches, flushing, sometimes chest pain. I started dreading intimacy because of what I'd have to go through physically. Michael was skeptical about the progressive tension principle, but agreed to try it. 4 months later, he threw away his pills. I wish I'd known about this years ago, he told me. I could have saved myself so much money and frustration. Michael's experience highlights another important aspect. This technique doesn't just address the physical symptoms, it addresses the root cause. Pills increase blood flow temporarily, but do nothing to strengthen the tissues that maintain that blood flow. They're a band-aid, not a solution. The progressive tension principle, when performed correctly and consistently, creates lasting change in the tissue itself. Many men find that after 6 months of daily practice, they can reduce to a maintenance schedule of 3 times weekly while maintaining their results. Now, I want to be absolutely clear about something. Patience and consistency are essential. We live in a world of instant gratification, but your body doesn't work that way. Tissue regeneration and strengthening is a biological process that occurs on a cellular level. It takes time. I want to address a concern some men express. Is this safe long-term? The progressive tension principle mimics natural processes of tissue adaptation. When performed correctly, with gentle progressive tension rather than aggressive force, it's safe for ongoing use. Many men maintain their results with a reduced schedule of 3 sessions weekly after the initial 6-month period. The key is listening to your body. If you ever experience pain, discomfort, or unusual symptoms, stop immediately and consult a healthcare provider. But for the vast majority of men, this technique remains safe and effective for years of use. As we age, maintaining sexual health becomes increasingly important for overall well-being. Research consistently shows that sexually active older adults report higher life satisfaction, better mental health, and even improved cognitive function. The benefits extend far beyond the bedroom. Thomas, 73, told me something profound after 6 months of practice. It's not just about the sex, it's about feeling complete again, about having that sparkle in my eye when I look at my wife, about the playfulness and connection we thought we'd lost forever. That sentiment captures the true power of this technique. Yes, it improves physical function, but more importantly, it restores connection, confidence, and joy. As we conclude, I want to emphasize that sexual vitality is your birthright at any age. The narrative that men must accept decline as inevitable serves only those profiting from expensive treatments and medications. Your body has remarkable capacity for regeneration and renewal when given the right tools and techniques. The progressive tension principle offers something precious: a return to natural function without dependence on pills, injections, or surgeries. It puts control back in your hands, literally and figuratively. 4 minutes daily, No equipment, no prescriptions, no side effects, just your commitment to reclaiming what's rightfully yours. Will you join the thousands of men who have already transformed their lives with this simple technique? Will you make the commitment to yourself, to your partner, to your quality of life? The choice is yours, but I can tell you with absolute certainty, based on decades of clinical experience, that few decisions will have a more profound impact on your sense of vitality, confidence, and masculinity. Don't miss our next video that's appearing on your screen right now. Click the card and discover another powerful technique that works perfectly alongside the progressive tension principle. Together, these methods can accelerate your results and restore the complete confidence you deserve. Click now. Your future self will thank you.